put together a general outline, but can certainly be steered in another direction if you have some questions, even as it might relate to yourself. And one of the things I just started with was just chemotherapy in general. Now, chemotherapy in general, not necessarily head and neck cancer. And I might ask, have you had cancer treatment and chemotherapy? And what I found is that it really varies quite a bit in the mouth. You know, some people have a lot of sores. Some people don't have many sores. Most people seem to get the metallic taste, which usually goes away after about 3 to 6 months, depending on what your experience might be. The thing with chemo, and it sounds like maybe you've already that is the typical thing. There's AIDS and then this oral mucositis. And oral mucositis is just like it's like a bad canker sore in the mouth. And that's the one that sometimes people get it with all different types of chemo, some people don't. Dryness has a tendency to come and go. Overall chemo, sometimes you'll have dryness. It may be there for about, again, typically 6 months, and it goes away. The taste sometimes can vary, but then that usually comes back after about 6 months or so. Oftentimes people, the one thing, again, as you start chemo, if you're in the midst of dental work, particularly if there's an infection or something that could be a problem, ideally you get that addressed prior to chemo. There are times when people develop a significant problem. I don't mean, a regular filling or a regular cleaning, but they have a bad toothache or they need to have a tooth out. Though usually, if need be, they may stop the chemo and let the blood counts come back up before we do any dental work. But as far as routine work, that can be done as long as you're tolerating it okay. If you're fine, we're fine. But elective treatment is good to be done during the time you're having chemo, although it would be suggested to do that. I mean, that's something you would want to wait until after you were past the chemo phase and had your counts back to normal, really having any problems. I might ask, did you have any issues with mouth sores or any of that during the chemo phase?
I haven't started it yet.
No, I've not had no trouble with the mouth sores.
Okay.
I have had, my taste buds aren't the same, but they are better than what they were. And the dryness of the mouth, that does seem to come and go, but I think I've got other issues, with some different things. And that's what I was hoping tonight.
Yeah.
Maybe I could figure some of them out.
Yeah, and then please, as we go through, if they're not, because the radiation to the head and neck is really a bad thing in terms of just like the recovery. And I'm kind of sensing you may have had some head and neck radiation.
Yeah, I've had radiation, I've had chemo, and then they also did a surgery on me.
Mm-hmm.
I don't, you know about that?
Yes.
And I could be wrong. They call it a flap.
Yep.
All right, that's what they did to me.
Did you have some of the floor of your mouth and tongue resected with a flap?
Say that again so I understand it.
So was your primary cancer site on
my
tongue?
left side, it was in my tonsil.
Tonsil.
They removed the tonsil and some of my tongue.
Yep.
And then they put a plate in my jaw where they did the surgery.
Mm-hmm.
But I have to have a knee replaced, and I'm trying to get clearance that I'm okay for the surgeon to give me a new knee.
Because they're worried about your dental.
Well, because I got pain in my tooth.
Yep.
But I don't know if it's the plate in there. I don't know if it's a tooth. And I went to other dentists, but they really don't want to mess with it because they see all the screws and the plate in there.
Well, let me just say, if you need someone to take a look for clearance, I'm happy to do that.
That's, I mean, because I'm gonna tell you just a little more than I
Yeah.
want to hold everybody
You're
up.
not holding
No.
anybody up. You are just fine.
Because I pulled my own teeth out
Okay,
because it hurt so bad.
yeah.
And
Yeah, why don't we get you, let's make sure that we connect, and I'm
Okay.
happy to take a peek and kind of see if I can help shed some light on that.
And if I do that a lot, it's because I have a hard time cussing sometimes. I don't understand myself.
It's okay.
I can't hear myself.
Yeah,
Yeah,
Yeah.
but you're doing well.
you really
They
are.
say that.
Yeah,
Yeah.
you are
They
doing
say
well.
Yeah, you can tell, yes, I can tell you've had a tongue resection and you just can't move it around like you used to be able
But-
to.
When it first happened, and I just want to encourage people, I could not do this.
Hmm.
And I couldn't do it on this side at all,
Right,
Well, now you have, yeah.
and
So it
now I
comes
can't.
back.
But I work pretty hard at it,
yeah, yes, it's almost like physical therapy in the mouth.
every day.
Yeah, you can't give up.
And with the taste buds, I didn't know if, because I do eat hot and spicy stuff,
Mhm.
and it hurts. But the next day, it seemed like I swallow better.
Mhm.
So I don't know if that's is exciting taste buds.
Mhm.
I don't know what it's doing.
Yeah, or saliva.
Well, that saliva stuff, I don't know if she was at one of the meetings, but if I get emotionally a little upset or something,
Mhm.
it seems like I create a lot of saliva.
Mhm.
If I get, being outside with their cold weather coming now, and something happens over here, then I can't understand nothing I'm saying.
Right.
So I want to listen to you, then
Yeah, and maybe there's some products that we'll talk about that might be helpful too. But I think as you look to getting started in chemo, for anyone who might be, is that you can typically expect a metallic tasting mouth that will go away. You may have some intermittent dryness that usually will get better. Sometimes people will say it never is quite the same, but typically with just chemo in general, that has a tendency to come back normal. And the sores in your mouth just really vary. You know, it just depends on what chemo and where you are. But as I was saying, as it relates to dental work, the only thing that you want to do, kind of similar to what you were saying, is that if you're getting started, is just making sure you don't have a potential dental infection lurking, or that you're worried about something or something's bothering you, because as you all well know, as chemo affects those cells that help fight infection. And if you're just lurking or kind of getting along without an issue, and then as you go on chemo, then there's a tendency for things to become a problem. And you just hate to have that happen when you're in the midst of it. Products. One of the things that you'll hear people talk about, whether it's dental or the oncologist, is just what's called magic mouthwash. Magic mouthwash is a prescription. And in there is a variety of different pharmaceuticals that can help with primarily pain that's associated with, again, I say oral mucositis because you might see that, but those are just bad mouth ulcers. And there's in the mouthwash, there's some prednisone, there's something that kind of helps things stick in your mouth to help coat where the sores are so that it lasts a while. And then there's some prednisone in there as well. So it helps with inflammation. It helps with numbing the inside of your mouth. And then it's coated so that it stays in there a little bit more. Not everybody needs it, but it's one of those things that can be helpful depending on where you are with the sores that you have. We were talking just a little bit earlier about saliva substitutes, and we'll talk a little bit more about radiation on the next one, but as it relates to during the time you're going through chemo, they make, and again, you may have some comments that what's been helpful for you, because everybody finds different things, works differently for everyone. There's what are called xylem melts, which is basically it looks like a lozenge that you can put in the side of your mouth to try to help stimulate saliva. There's sprays. Now, my experience with a lot of the people I see who've gone through chemo and radiation is they like the spray because it's in a small bottle and you can keep it on you. And there's a group, it's called SPRY, S-P-R-Y. S-P-R-Y. They have, I'm just going to see if, they have a lot of dry mouth products. And I say a lot because you can pick and choose to see what works out best for you. And I know they have a robust website, but they also, Whole Foods and Fruitful Yield in the area has a lot of these natural and or substitutes. So if you want to go and look somewhere, they typically have a shelf full of that. But if you go online with Spry, you'll see all these different products they have. Now, the mouthwashes usually are very transient. You know, they don't last that long. And you'll see lots of mouthwashes that will market dry mouth, but nothing that really sticks around long enough to make a big difference. The lubricants and the sprays people have more success with. And those lubricants, Spry makes a lubricant and they also make a spray. Biotene, which is another this you can get actually at the pharmacy, like a Walgreens or Osco, or at least check with the pharmacist. Biotene, B-I-O-T-E-N-E. They make a lubricant, and I don't know that they make a spray.
They do. I'm on their website right now.
Okay.
Linking it for our virtual
And
audience.
they
Here.
used to just do the lubricant many years ago, and that was kind of the go-to. Now the lubricants are just like an intraoral Vaseline. They're not quite as sticky. They're real, they dissolve quickly, but you can use that as much as you want, and it's not going to be a problem. So before you eat, before you go to bed, the lubricants you can put in, you put a little bit on your tongue, and you just work it all through the inside of your mouth, and then you just keep it bedside. Because we all know, even if we haven't been through some of the things that you've been through or with chemo, is that sometimes we wake up in the middle of the night, particularly in the wintertime when the air's dry, and you just feel really dry, and, you know, things just are very sticky. The lubricant can help with that, and the spray helps out a lot with that. The spray, the Spry spray, again, people will keep it in their bedside or they'll keep it in their purse or pocket. That way, when they have it, a couple little spritz and you're good to go. There's nothing in there that causes decay. One of the things, as I mentioned, decay, you'll see people that will start using lemon drops, because everybody always says, well, use a lemon drop, that'll get your saliva going. Well, the problem is that it tastes good for a reason. It's full of sugar, and wherever you put it in your mouth, you have a tendency to not only become more caries prone, decay prone, but also it erodes your teeth. So that acid will erode your enamel, and then you just get a fair amount of decay to start, so you just end up with a lot more of an issue. But the Biotene and the Spry products, they use types of sweeteners that the bacteria in our mouth have not figured out how to use to demineralize your teeth. Some toothpaste will be very aggravating because they sting. You know, everything bubbles in your mouth, and sometimes when the skin on the inside of your mouth, the mucosa, because it's irritated from the chemo, your toothpaste may bother you. So what are your alternatives? Well, one is at it's called Tom's of Maine. You can pretty much get that anywhere now, but that's an all natural type toothpaste. One of the things that's in toothpaste, and I don't expect you to, do you have sodium lauryl sulfate, but the sodium lauryl sulfate in toothpaste is what causes that bubbling effect, and it can be aggressive on gums and the inside of the mouth that's tender. So you just want to stay away from that. And typically Tom's of Maine will help. The other is there are prescription fluorides that the dentist, whoever you might see, can help. That's strictly a fluoride. It's a gel. It's always good when you are experiencing some dryness to use a supplement fluoride. It just helps keep your teeth nice and strong because your risk of decay is so much greater when you have a dry mouth.
We have a question.
Yeah.
Kanka, the mouth pain, it's like a liquid. Is that okay to use?
It is.
Yeah, okay. There we
It
go.
is. Now, as it relates to mouth pain, if you have a generalized just sore area, one of the things, Kanka works, but the other thing you can do is you can take a little bit of the over-the-counter hydrocortisone, a little bit of Fixodent, which acts as, it's like a Band-Aid, because the problem in the mouth is that things wash off. So you can put a little bit of Fixodent, and then you can use Kanka or Ambisol, and those are numbers. So it's an easy way to make a home concoction without getting into a big project. And because it's hopefully only going to be there for what might be a week or two, depending on the situation, you can mix that together. I'd keep the Fixodent to a minimum because that to come off can be kind of sore, but at the same time, it acts to coat. And when it coats, it's literally like putting a Band-Aid on that sticks there that helps cover it so that when you eat, it's not irritating all the time. So Fixodent, Polygrip, and then taking that, putting some Kanka and Ambisol. Just it'll say on the hydrocortisone, don't use in your mouth. Well, you're not taking a bunch of it and putting it everywhere in your mouth. You're just using a little bit, and all that does is helps with the inflammation associated with the sore that is caused by the chemo and/or radiation. But fluoride's a really good thing to try to use prior to your treatment or after, depending on how much dryness you have in your mouth. And it's fine to get your teeth clean. Again, that's kind of your call. Sometimes I'll have people come in at 3 months or more frequently during chemo or radiation if they just feel like they're having a hard time. Sometimes if you have a lot of plaque in your mouth, it'll help encourage, it just makes the soreness in the mouth a little bit more aggravated. And because things stick because of the dryness, it's not as easy when you're going through some really acute times where you might just need a little extra cleaning, obviously with a little TLC because your gums are real sore. Radiation to the head and neck is really the one that's the most brutal. And for a lot of the head and neck cancers, there's been a lot of help with how they direct the radiation and the protection that they use. But it's one of those areas, like a lot of things, you just can there's so many other things that are going on at the time of the diagnosis and working through your treatment plan that we don't often think or discuss what happens during and after. And oftentimes people will say, well, I didn't know this was going to happen. I had no idea what to expect with this. And with radiation, you definitely get a severe dryness of the mouth. And as we were talking about earlier, that dryness can be very long lasting. And when it does come back, it's oftentimes thick and ropey. So it doesn't have that real cleansing feeling like you can swallow. It's like it's always hard to swallow because it's just a thick, ropey saliva. And I'll mention some things that can be helpful with that. The mucositis is brutal. Usually at about 10 to 14 days in is when it starts to really kick in. And it can last through the radiation. Oftentimes that's what will stop radiation for a while until the inside of your mouth recovers. As we all know, cancer is a type of, the treatment is really focused on rapidly dividing cells, and in our mouth, the inside of our mouth is a rapidly dividing inside of the mucosas, constantly turning over. So that's one of the reasons that you get such soreness on the inside of your mouth, the way that the radiation and chemo affects it. But it's, and again, you have much more experience than I do, but it's almost having a 3rd-degree burn on the inside of your mouth as you go through that. And sometimes it'll get to the point where you actually, they'll put a feeding tube in because you just can't swallow because of all the soreness and difficulty in swallowing and pain that you have. I know for me, when I know someone's getting started, I just say eat as much as you want, as often as you can. Do smoothies, anything, because you gotta expect to lose weight. And again, I don't know how yours went, but
I used to be 192 pounds, and
Yeah.
I got down to 114.
And that's like so common. It's hard to wrap your head around that.
Mentally, it's hard on you.
Yeah, it's a really tough thing to go through. Your taste, as we were talking about earlier, it goes, but it typically comes back. It may not be quite the same, but at least there is some taste there. And of course, when you can't taste and you have all this going on, you just don't want to eat, basically. And that's where you get into the losing weight at a time where you need to try to keep yourself nutritionally sound. I wish I could give you a magic answer on, I would try all the different smoothies. I don't know if you found one that you liked, you know.
I just got at the point in my time, I couldn't even open my mouth anymore.
Yeah.
So I couldn't open my mouth. I couldn't eat no more.
Right.
So.
And I think particularly if you have radiation with some surgery, is that the surgery inside of the mouth, it tightens everything down, and the muscles get tight from the radiation and the surgery. And as we were talking about, just getting started on physical therapy type things in your mouth, which again, God love the surgeons, but it's not at the top of their wheelhouse to talk about at the time, because obviously they're focused to get it out and get you cured, which we need to have happen. But then there's this, well, now what? I can't open my mouth, I've got all the soreness. And so as soon as you can start doing exercises to open your mouth, it starts to really limber that up so that you can start to really chew again. Osteoradionecrosis. It's a fancy word that just says when you've had a lot of radiation, you're prone for your bone to die. And what sometimes that happens spontaneously because the amount of radiation, it doesn't happen as much in today's world as it did 20 and 30 years ago. But it just has to do with the target of the radiation and the dose that you're getting. So from a dental perspective, before you have the radiation, that's a time particularly where it's good to have your teeth looked at. And most times surgeons will say, go get your teeth looked at and checked, because the radiation in an area where you've had a lot of gum disease or bone loss or dental work, you're just a lot more prone to lose teeth in that area because the teeth are already compromised. Then the whole system becomes compromised because of the radiation. And if you have a tooth out in an area where you had the radiation, you become more at risk for this osteoradionecrosis. And that just means that the bone dies, and it's just a nuisance. you know, it exposed, and then you have to clip it off and clip it off. Sometimes it'll start to close over, but a lot of times the bone just stays exposed, typically on the inside of the mouth. Sometimes you'll see it actually on the outside, but most of the times it's on the inside. One of the things that people have told me with the radiation and that extreme dryness and the thick ropey saliva is that actually ginger ale kind of breaks up the saliva a little bit, helps you swallow.
Diet ginger ale, that's the go-to soda.
Yeah.
It helps you swallow.
Yeah.
It does. I mean, I can do like cherry Cokes, but that ginger ale, diet ginger ale,
Yeah.
it's pretty amazing. And I heard that somewhere. That's why I tried it.
Yeah. Yeah, it's of the other thing of the people I've talked to, ginger ale, diet ginger ale seems to be the go-to, break it up and swallow. The other thing that people, when it gets, particularly with the mouth sores, there's a lollipop that has xylocaine in it, and that can be really helpful to suck on before you eat, or just when you have that soreness, it just kind of takes that edge off a little bit. And usually that's when, during the time you're really at the height of your radiation, and or if you have some bad sores related to the chemo. Radiation and dental work, certainly during the time you're having radiation, I'm sure you can attest, last thing you're doing is dental work. You know, unless you've got a really bad toothache, it's game over. There's this, whether it's a cleaning, a little filling, a chipped tooth, just smooth it and get me out of here, because stay open for any extended period of time just doesn't work. But when you go forward, extractions, it's good for the dentist to be aware of if you've had radiation treatment, because you're a little higher risk for the site not to heal well. Implants would be up to the oral surgeon and the site. I'm not saying it can't happen, because I've seen people have implants, and that just depends on where that bone may have been most affected. So if you had it on your lower right, that might not be a great place for an implant, but you may be okay on your upper left, you know, just depending on how the radiation hit. Fillings, crowns, cleanings, dentures, partials are fine. The problem you get into with a dry mouth is that when you have dentures and partials, the moisture of the saliva helps hold it there. And so if you can imagine two sheets of glass and they get water between them, they're hard to peel off sometimes. Now that doesn't, I wish I could say that always happens in your mouth, but having saliva there definitely helps with dentures. And when you don't have that, it's really a problem to get them to stay in, let alone the fact your movement has been affected quite a bit. In today's world, again, if it comes to that, there's implants, depending on where it is, to help hold things in. Or a lot of the adhesives can be helpful, and meaning Polygrip and Fixodent. And then you can use those oral lubricants. So Spry and Biotene, you take the lubricant that you work on the inside of your mouth, you do that before the denture goes in, and you mix some of that with your denture cream. And that just kind of gives some moisture to help stick it into place where it's not so dry. And then just keep handy the spray or the mouth lubricant to be there. The products for the radiation are basically similar to the ones that you do for chemo. It's just that the radiation, the symptoms are more intense and it goes on for a lot longer period of time. Typically with the chemo, again, it's just during that time you're having the chemo. One of the things that's come up a lot now, and it's not necessarily always related to cancer, but can be, some of the breast cancers and or prostate cancers, you'll use a bisphosphonate. And the whole idea there is when you get some metastasis in bone, that you're trying to slow down the spread within the bone. And so Fosamax, Prolee, and Reclast. Now, Reclast is the one, that would be the one you typically might use in a cancer situation. At least that's what I see in the practice. It's IV, it's given once a year, but it's also the one when you look at the bisphosphonates, can be the one that causes the most jawbone death. So a lot of women who are coming in that are on the cusp of osteoporosis, and they're having conversations with a physician about, do they go on Fosamax or Prolia? They'll be in pretty quickly and be intimidated by taking it, because when you read it, it's like, oh my God, I don't want to take this. I'm going to lose my lower jaw. Well, with Fosamax, which is kind of the first line oftentimes of that type of treatment for osteoporosis, it's very benign as it relates to jaw problems. I mean, you can see it happen, but it's really rare. I mean, unless it's in combination with a steroid, most times it's not a problem. With the Prolee and Reclast, a little bit more so. Anytime we have to take a tooth out when people are on that, there's different vacation times that people will go on, but nobody really knows because it really stays in bone a long time. So it's a little bit of a pot shot. You know, who wrote the latest paper that has some credibility. But I do know with Fosamax, it's not nearly as concerning as it was in the beginning, because most of the time there's just not a bad sequel that comes with that. But I definitely have seen with particularly people with multiple myeloma in particular, and they're on the IV bisphosphonate, and they have a tooth out, particularly in the lower jaw, they can have a real tendency for that to happen. Again, it's not like I don't want to make light of this, that you're debilitated from it or that it causes death, but it's a nuisance because the tissue of the bone that covers the bone, there's always spicules of bone that's working their way out. And so then you have to come in and we have to clip it. And it's a real problem, obviously, if it's in an area where you have a partial or a denture, that's trying to ride on that so that you can eat, because it's just sore a lot of the time. Sometimes those will cover over with time, but sometimes it just keeps moving itself around the jaw. And it's typically more in the lower jaw. The lower jaw is more dense. The blood supply is different on the lower versus the upper, where you have a more robust blood supply and things tend to heal better there. But it's definitely something to be aware of, not only as part of a cancer chemotherapy, but also just in general, as people are more in tune to their overall well health and osteoporosis that can come with age.
We do have a question about other chemo drugs, particularly aromatase inhibitors in breast cancer. Do you see any side effects with that? Any oral hygiene issues with that one?
I haven't,
okay.
But I will say sometimes these agents change so much with what they're on. Mm-hmm. And I don't know, of course, in today's world, between a place like Living Well and your on-site chat areas, there may be something that comes up, but I would say that it would be one of those things that would be definitely nothing with the bone, but something that where you might have a little bit more taste, saliva, or maybe mouth sores.
Okay, perfect.
So I might open it up for conversation or any other questions that you might have. And I'm happy while you're here we can answer some of those, and I'll make sure you get my information so that we can take a quick look and get you taken care of.
I probably have a lot of questions, but
Please,
You
Please.
really don't know where to start. Let me think a little bit. Maybe she's got some questions.
Okay.
I've got
I,
someone
uh,
typing here, but go ahead,
No,
please. No, they're not done typing, so please go.
Yeah, I'm just wondering, like with my, I tried Biotine,
Mhm.
but not the spray. I'm trying to remember, and I have a problem because I can't write, I can't spell, and I can't work one of those things. So
I've got something for you.
I feel like I'm really, but I don't like to take a lot of medicine.
Right.
I'm not into that at all. But even with after everything they did to me, I am proud, but I'm happy that I only take one thyroid pill. Is all I take for medication. This hurt that I have in here, the doctor said, if it's that plate that's bothering me inside my jaw, she would like to not take that back out.
No.
No, yeah, and if that means all that again, no, I don't want that. I'll deal with it. But if it's a tooth, I want them to see if they can
Right.
do something with that, you know? That one stuff you said to spray, will that make you sick to your stomach? Will that, does it have any, by using it too much, does it cause more problems with your body?
So that's the nice thing about that spray. There's a lot of just natural products in there, aloes in there, and there's nothing in there that you could use it too much that would cause a problem. And I don't even have people that mention that they get stomach upset from it. It's a real mist, you know, it's not like you're using Roundup on a weed. You know, it's very misty as it goes in.
Is it my dry mouth? Because if I eat something that sticks in there, is that the dryness not letting me swallow it?
So for you, there's
Or is there
probably,
more going on?
well, the dryness is huge. But the other thing with you is you've lost some of your tongue mobility, you know, as you move things
Yeah,
around and
because
sweep.
you know the thing you said to put in your mouth,
Mhm.
if I'm not careful, if I put something in my mouth, it'll go down my throat,
Yeah,
and I can't control it always.
no.
So,
Well, we were talking earlier, because I think your background is in
Speech
speech.
path, yeah.
Yeah, and so when I was at the hospital, that was always one of the big things with what you've gone through is, you know, making sure that when you swallow that everything's going in the right
Right.
path.
right.
And that can be tough. I mean, I'm sure you've kind of got it figured out now where you
I
it
do,
most
yeah,
of the time.
but you gotta be careful.
But you gotta watch, yes,
Gotta be careful.
absolutely.
Yeah.
And it's, I'm very grateful for everything that everybody's done, but it's a job,
Mhm.
it's a job.
Yeah,
You know, and I'm always looking for somebody that can help me, that has experienced what I experienced, so I can get some ideas, you know, I'm hunting for ideas of something.
yeah, and that's the other thing. I just actually have a patient that finished up something similar to what you've, although we fortunately caught it really early, didn't need to have the radiation treatment, but he did have the surgery, and he's worked through some of the issues with the immobility of his tongue, but he also has the benefit of not having had the radiation for swallowing. But I'm just thinking off the top of my head, as we finish up today, that might be I'm sure he'd be happy to talk to you about that as well.
Yeah, because, and that's why I was saying, when I eat something spicy, and I think, you know, because I'm always trying to take care, that rope like saliva, I have to use the blue sponge
Yep,
to clean out the side.
yep.
But if I eat spicy and eat like ribs from
Mhm.
Portillo's, the next morning, that seems less.
Hmm.
The rope seems like it's not, there's some there.
Yeah.
It doesn't, but it's like, but if I eat, like, there's a little certain cake I eat, and if it's real cold, I can eat it. but the next morning, that's real heavy in there.
Mm-hmm.
So, I'm like, I better taste good, that's why I need it.
Yeah, well, anything that tastes good, but yeah, you should pick up that spry.
Spry, you're saying?
It's the spray. Because I'm just curious if you have that nearby.
Would I
while
be
you
able to
eat.
do that and then eat like at a restaurant, bread's hard for everybody. But last weekend, last Saturday, and I was out with some friends and I had Chicago dog with the little peppers. And I ate that without taking one drink of anything. Now it's hard. It's hard. But without the cheese here, I couldn't really bite the bun and the hot dog. So it's at home, I can always cut it and take bites. But that's a milestone for me.
Yeah.
To
Right.
eat a hot dog on a bun.
With your hands.
With my hand.
Yeah,
I mean,
nice. Good deal. Yeah,
It's
simple
fun.
things.
We do have a question here.
Yeah.
There is a participant who's about to start chemo, so she's asking if there's any preventative care for dry mouth or mouth sores or anything before she gets started. Is there anything she can do?
And this sounds almost like, well, yeah, I understand that. It's really about really staying on top of your overall oral hygiene. And there is some evidence to suggest if you have a fair amount of plaque or bacteria in your mouth, that you become a little bit more susceptible to some of, particularly the sores in your mouth. So you may want to just, if it's been a little while since you've had a cleaning, get a good cleaning. And I tell you, those toothbrushes today, I'm just, the Sonicare, the Oral-B, and on top of that, even if you're, of course, dentists are always talking about flossing, but believe me, I get it. Sometimes it's the last thing you want to get into, but the little brushes that go between your teeth, they're proxy brushes, and if you go to the pharmacy, my God, there's every proxy brush size in the world to fit between your teeth. And you just put a little bit of toothpaste, and you might want to think from a preventive standpoint, kind of play around with either Tom's of Maine or Sensodyne, and you just use the electric brush with that, which you may be using already, and then the little brushes that go between your teeth, just put a little bit of that on the piece that goes between your teeth and just work it in between your teeth and just get in the habit of doing that. Saliva, I mean, there's nothing, you can really do with that. And it's the same thing with the mouth sores. I will say most times mouth sores don't happen with a lot of chemo. And then there's others that go through a phase and it can be real intermittent where you get one or two that are real sore, might be like that for 10 days and then it's gone. Now magic mouthwash, you just have to see how it goes for you. There's not anything preventively or like taking an antibiotic or taking some kind of pill to keep that from happening. It's just really about keeping really good oral hygiene. And then as those things start to pop up, and then at that point it's palliative, just trying to make it so it's a little bit more tolerable or not as sore when you eat. And talk to your oncologist as you go through or your dentist about, I think I need something a little bit more, and that would be the magic mouth rinse. Or we were talking earlier about putting something, if it's just like a canker sore on one area, you can use the Canka with a little bit of, or Ambisol with a little bit of the denture cream to help hold it there.
That's great. Thank you very much.
So.
I'm asking for any other questions online. Any other questions here? No? All right, great. Well, then I'm going to end the formal presentation. Then I'm going to let you two connect here. So thank you.
Oh, you're welcome.
For your time.
Yeah, oh my goodness.
Yes, and
love living well.
Absolutely. My virtual audience and my in-person audience, this will also be up on our YouTube channel tomorrow. So if you want to go back, make references, etc., let me know. But you guys know how to find me. I'm always here. So
Thank you, Ashley.
Thanks, guys.
Appreciate it.